In the news at 5:30, promising news in the world of women's health care. There are two new non-invasive technologies that could help diagnose endometriosis sooner. Endo is a condition where tissue similar to the lining of the uterus grows outside the uterus. It can cause chronic inflammation, scarring, and severe pelvic pain. It's estimated to affect 1 in 10 women, but often it takes years to diagnose.
We are now joined by Dr. Jalise Sosa, Medical Director of OBGYN Centers at Golisano Children's Hospital of Buffalo. Dr. Sosa, thanks so much for being here.
Thanks for having me.
Talk to us a little bit about what this breakthrough means for patients in women's health care.
Any advancement that allows women to be able to have an answer sooner is a big deal, so we're excited. And like you said in the introduction, it could take about 10 years for a woman to be diagnosed. So imagine having something where you could have a diagnosis within 45 minutes. That's a big deal.
That's insane.
Yeah.
Okay, I know a lot about this. I have a lot of friends and family members who have dealt with this, but I want you to explain to the viewers exactly what this is. First of all, I guess explain why would it take 10 years to diagnose endo? It is an extremely painful condition that a lot of women deal with.
Yeah, it's really unfortunate that that's been the history of this disease. And it comes from not listening to women when we present to an office. It comes from normalizing painful periods, really, and saying, oh, that's just what periods do. And as a result, we think, okay, I'm just sort of on the worst side of this, and I was just unfortunate. And then it comes with the fact that we didn't study this enough initially. And instead of saying we need to do more, I think what we did, unfortunately, as scientists, as physicians, is say, well, we don't know, so maybe you shouldn't worry about it. And that's not okay. And thankfully for advocacy from patients themselves, and from, I think because there are more women involved as OBGYNs now too, that there's been more research and more interest in making sure we find answers.
Can you explain diagnosing then, and I mean, we're still kind of doing that, versus what is this new testing?
Yeah, so traditionally women are told, we can't diagnose endometriosis unless you have surgery. And that, thankfully now, is not true. So one, these tests, the EndoSure and the Endo test, allow patients to just do a saliva test. The Endo test just check some biological chemicals in the saliva, and within 45 minutes you have an answer. The EndoSure uses sensors on your belly, just like if you were to do an EKG, and then lets you know these electrical signals seem similar to what we'd seen in endometriosis. So that's really helpful versus a patient then having to go to the operating room first before being able to say, yes, you actually have this disease.
So two incredibly, hopefully, accurate ways to test that are non-invasive for the first time in history, as you said, and as we asked at the huge development. When it comes to something like this, what kinds of symptoms should women be paying attention to? What is perhaps different from something that might be more typical, that may come along perhaps with your period or something like that, versus when it's time to maybe talk to your doctor?
Yeah. A period that really just disrupts your life. You have pain where you're missing work, you're missing school, you're unable to function, you may have pain with intercourse, you may actually have sort of non-typical symptoms where you've seen a gastroenterologist, so this is a GI doctor, and you don't have IBS. They say it's not related to your stomach, it's not related to your colon, but you still have this pain and discomfort, and you just don't have an explanation. I think it's time to start thinking that endometriosis might be the cause. It's just not normal to have periods that disrupt your life that much.
What are those first steps? Because once then you make that step and you make the decision to have that conversation with your doctor, what should a woman expect as next steps?
Yeah, I think we do have to do some work to make sure that other physicians are fully aware. I think a specialist like me, of course, is very much aware. Gynecologists are aware. They may or may not be able to do the surgery to treat, but they may be aware of it. Many women may be presenting to their primary care doctor who may not know. So I think it's on us to make sure we train our colleagues. And thankfully, we live in a world where a lot of women are going online and doing their research and advocating for themselves. So if they are in a scenario where they suspect it's endometriosis, they're not being heard in the office, they could seek out a specialist like myself. They could speak to their gynecologist and specifically say, do you think this is endometriosis? And have that person truly do the workup and assessment for it.
Absolutely. Let's talk about what the future might might look like. So this is great that we can diagnose it sooner. I cannot believe it's 2026 and we're just finding this out. But what does the future look like for treating this? Because the surgery can be very painful to remove endo and can take a person, out on bed rest, for a while afterward.
Yeah, in an ideal world, the future would look like some sort of medication that stops the inflammation, perhaps stops that genetic conversion that starts endo in the first place. And I think there are a lot of studies being done trying to figure out what exactly is that trigger that causes it, that could then say, stop this inflammation, stop triggering these nerves to feel pain, and or even where we get to the point where we stop having those cells that grow outside of the uterus do that. But for now, treatment are two options. You could either have medication, which is usually hormonal because the reproductive system is a hormonal system, and that's ideal for a person who may not be ready for surgery. Their symptoms are maybe mild, or they have other goals, fertility, things like that. So you do this medication in the interim, and then if it's pretty extensive, if it's very deep disease, which really is debilitating, sometimes we do surgeries on the lungs, on the colon, and in the pelvis because it's that extensive, then that person just needs surgery, and excision and removal of the pathologic disease is what helps improve their symptoms.
And it really is life-changing for folks.
Yeah, I am fortunate to be in a job where when the work that we do, we really sort of see that immediate change and how much it makes a difference in a woman's life. And grateful that we get to do that.
Without question.
Thank you.
Dr. Julie Sosa, thank you so much for being here. Thank you for what you do. And it's great to be able to share with you and with our audience some positive news about women's health.
Exciting.
Thank you, Dr. Sosa.